My name is Rosumi, and today we are going to talk about reproduction and HIV or AIDS. The ability, the ability to reproduce is one of the properties that distinguish living matter from non-living matter. The more primitive the animal, the simpler the process of reproduction. In animals, including humans, the process is sexual reproduction. Sexual reproduction helps support evolution and the production of new generation. On the other hand, unprotected sexual reproduction with a unknown partner increase the risk of acquiring sexual transmitted disease, such as HIV or AIDS, which can be fatal. Next, Gatan will talk about anatomy or physiology and physiology.
My name is Getan. I will be presenting anatomy and physiology. Female reproductive system. Understanding female reproductive system anatomy includes the study of the external and internal structure of and the hormonal cycle. Structure. The external genitalia, also called the vulva, includes the mons pubis, the labia majora, the labia minora, the vagina, the vagina opening, the urethra opening, the clitoris, and the perineum. Internal reproductive anatomy. The internal reproductive anatomy includes the uterus, two ovaries, two fallopian tubes, the urethra, the pubic bone, and the rectum. The uterus contains an inner lining called the endometrium. The lower portion of the uterus is called the cervix. Menstrual blood flows through the os into the vagina during menstruation. Semen travels through the os into the uterus and fallopian tube following ejaculation during sexual intercourse. The cervical os dilates during childbirth. The ovaries located on each side of the uterus and the female gonads. The ovaries produce estrogen and progesterone. The fertilization, which is the fusion of the male and female gametes, take place in the fallopian tubes. Menopause. Menopause can be defined as the end of the menstruation, occurs between the ages of 45 and 55. Menstrual phases. Menstrual has 4 phases. The first phase is menstruation. The second one is follicular phase. The third one is ovulation. The fourth one is luteal phase. Male reproductive system. The male reproductive system, to understand the male reproductive system, we must know the external and internal structure and the process of spermatogenesis. Structure. The male external structure are the penis and the scrotum. The penis consists of the glands and the shaft. The glands is covered by the fold of skin called the foreskin. The internal structure are the testes, which are the male gonads and contains hundreds of tiny seminiferous tubules where sperm cells are produced. The epididymis is a small oblong body which rests on the surface of the testes where sperm matured and are stored. The epididymis leads into the vas deferens. The vas deferens extends to join with the ducts of the two seminal vesicles to form the ejaculatory ducts, which extend through the body of the prostate gland and empty into the urethra. The Copper's gland are found on each side of the urethra, just below the prostate. The process of spermatogenesis. Spermatogenesis begins in the seminiferous tubules of the testes. Sperm pass into the epididymis where they mature and be able to move through the vas deferens and into the seminal vesicles where they mix with seminal fluids. The mixture of the fluids and sperm is called semen. The fluid which is released by the man during ejaculation. The next part is etiology. Mrs. Rose will be presenting etiology.
Thank you, Gaitan. Etiology. So where did HIV come from? HIV is from chimpanzee version of virus called SIV, simian immunodeficiency virus. In 1999, researchers found a strain of SIV in chimpanzee that was almost like HIV in humans. Upon this discovery, they conclude that chimpanzees were the source of HIV. and that the virus was transferred to humans at some point. So how did HIV across from chimp to humans? The hunter theory. This is the most acceptable theory by scientists. As the name suggests, it has everything to do with hunting. Scientists explained that SIV was transferred to humans because of chimp being killed, eaten, or their blood getting into cuts or wounds on people. This enabled the virus to adapt itself to its new human host and become HIV. Study shows that first transmission of SIV or HIV in humans took place around 1920 in DR Congo. What causes HIV or AIDS? HIV infection is caused by human immunodeficiency virus. You can get HIV from contact with infected blood, sperm, or vaginal fluid. Most people get virus by having unprotected sex with someone who have HIV. Another common way of getting it is by sharing drug needle with someone who have infected with HIV. Last but not the least, the virus also can be passed from a mother to a baby during pregnancy, birth, or breastfeeding. Now I will call on JC, who is going to present pathogenesis.
Thank you, Rose. So what is pathogenesis on HIV? HIV pathogenesis is the progression of the human immunodeficiency virus or HIV in a patient's body. The term describes the initial state of the virus and the long-term effect it has on cell organ functions. HIV infection vary in patients and may be identified through different symptoms. Researchers following HIV pathogenesis usually begin by identifying how the virus was transmitted. The virus quickly attacks the white blood cells, which help fight and contain infections. The disease gradually weakens the entire immune system of the body until it is unable to stop the virus. Once that happens, the virus and other harmful microbes begin multiplying and spreading throughout the body. The protective immune system cells can be destroyed in different ways. They can be attacked directly by the virus cells, or they can be damaged through a process called synthesia. Synthesia causes infected cells to fuse the healthy ones, forming large bloated cells and destroying them in a process. Cells can also be harmed through apoptosis, which is a process that sends false signals to immune cells and cause them to self-destruct. The spread of HIV usually reaches spinal fluid and those around the brain. Some patients do not feel the effects of the virus at this stage. Others, however, begin suffering from flu-like symptoms such as fever, swelling, and headaches. Often these symptoms last only a few weeks before disappearing, which can lead the person to believe he or she is healthy. This full recovery can allow the disease to go unnoticed for a prolonged period of time, even years, until it reappears. The reemergence of the HIV virus sometimes leads to a more serious condition called acquired immune deficiency syndrome or AIDS. This illness can complicate other diseases and cause deadly tumors and lesions, fatal in many patients. AIDS has become a pandemic that has killed millions of people worldwide. Generally, one the best way of fighting AIDS and prolonging life for someone with the disease is to monitor the patient's HIV pathogenesis and treat the infection when it first appears. So the next part will be signs and symptoms presented by Ms. Sidikat. Please.
Hey, thank you. My name is Sidikat Brown, and I'll be talking about signs and symptoms. The primary HIV infections may be asymptomatic or cause transient non-specific symptoms. Acute retroviral syndrome. Acute retroviral syndrome usually begins within 1 to 4 weeks of infections and usually lasts 3 to 14 days. Symptoms and signs are often mistaken for infectious mononucleosis or benign. Non-specific viral syndromes and may include fever, malaise, fatigue, sore throat, arthralgias, septic meningitis, several types of dermatitis, lymphadenopathic, And symptoms during this relative asymptomatic period may result from HIV direct or from opportunistic infections, most common lymphadenopathic white liquid due to oral candidiasis, hives, zoster, diarrhea, fatigue, fever within intermittent sweat. Talking about diagnosis. The best way to know your HIV status is to get tested. Blood tests are the most common way to diagnose HIV. These tests look for antibodies to the virus that the body creates in an attempt to fight the virus. People exposed to the virus should get tested immediately, although it can take the body anywhere from 6 weeks to a year to develop antibodies to the virus. Follow-up tests may be needed depending on the initial time of exposure. Early testing is crucial. If you test positive for the virus, you and your doctor will discuss and develop treatment plans and can help fight HIV and lots of complications. Early testing also can alert you to avoid high-risk behavior that can spread the virus to others. Most health providers offer HIV testing, often with appropriate counseling. Anonymous and free testing also is available. During testing, your doctor will ask about your symptoms, medical history, and risk factors, and perform a physical examination. There are 3 types of HIV diagnosis tests. These tests look for actual virus in your blood, virus load. They involve blood drawn from a vein. This is very expensive and it's not routineness. The person recently had a high risk exposure or a possible exposure with early symptoms of HIV infection. The test can usually detect HIV infection 10 to 33 days after an exposure. If you might have been exposed to HIV within the past few weeks, your doctor may recommend NAT test for the first test. Look for both antibodies and antigen. Antibodies are produced by your immune system when you are exposed to a virus like HIV. Antigen are foreign substances that cause your immune system to activate. If you have HIV, an antigen called P24 is produced even before antibodies develop. Antibody tests are recommended for testing done in lab and now common in the United States. An antigen antibody test performed by a laboratory on blood from a vein can usually detect HIV infection. Can usually detect HIV infection 18 to 45 days after an exposure. There is also a rapid antigen antibody test available that is done with a finger prick. Antigen antibody test done with blood from a finger prick can take longer to detect HIV, 18 to 90 days after an exposure. Look for antibodies to HIV in your blood or oral fluid. Antibody test takes 23 to 90 days to detect HIV infection after an exposure. Most rapid test and the only FDA-approved HIV self-test are antibody tests. In general, antibody tests that use blood from vein can detect HIV sooner after infection than tests done with blood from a finger prick or with oral fluid. So I'll be calling the next person, which is Ms. Jenny, to talk about treatments.
Thank you. My name is Jane. I'll be taking you through treatment on HIV. HIV treatment involve taking medicine that reduces the amount of HIV in the body. HIV medicine are called antiretroviral therapy, ART. There's no effective cure for HIV, but with proper medical care, you can control HIV. Most people can get the virus under control within 6 months. Taking HIV medicine does not prevent transmission of other sexual transmitted diseases. When should one start the treatment? One should start treatment for HIV immediately after diagnosis. HIV medication is recommended for all people with HIV, regardless of how long you had the disease or the virus. Talk to your healthcare provider about any medical condition that you may have or any other medicine that you are taking. Let your healthcare provider know if you or your partner is pregnant or thinking about getting pregnant, so that you can help not to contaminate the baby. What if I delay the treatment? HIV will still continue to harm your immune system. This will put you at a risk of developing AIDS. You can learn more about AIDS and opportunistic infection. The next step is this will put you at a risk of transmitting HIV to your sexual partners and other infected people. What are the benefits of taking my HIV medicine every day? Treatment reduces the amount of HIV in the body. The amount of HIV in the blood is called viral load. Taking your HIV medicine as prescribed will help you keep your viral load low and your CD4 count high. HIV medicine can make the viral load very low. That's called viral suppression. Viral suppression is defined as having less than 200 copies of HIV per milliliter of blood. HIV medicine can make the viral load as low that a test can't detect it. And the process is called undetectable viral load. If your HIV viral load goes down after taking HIV treatment, that means the treatment is working. You should continue taking your medicine as prescribed. If you skip your medication, you risk a chance of rapid multiplying of the viral load in your body. Getting and keeping an undetectable viral load or staying virtually suppressed is the best way to stay healthy and protect others. Does HIV medicine cause side effect? Yes, it causes side effect to some people, but not to everyone. The most common side effects are nausea and vomiting, diarrhea, difficulty sleeping, dry mouth, headaches, rash, dizziness, fatigue, and pain. Talk to your healthcare provider if the treatment is making you sick. Your healthcare provider may describe medicine that can help manage the side effect and make a change in your treatment plan. What if the medication is not working? If the medication is not working, you should talk to your healthcare provider. He can change the prescription. A change is not usually because the same treatment does not affect everyone in the medicine does not affect everyone in the same way. I'll continue with diagnosis. What is diagnosis? Diagnosis is a Greek word that means foreseeing or foreknowing or foreseeing. In medical terms, is predicting the rivalry or expected development of a disease. Prognosis is made on the basis of the normal course of the diagnosed disease, the individual physical and mental condition, the available treatment, the expected duration, function, and description of the cause of the disease, such as progressive, decline, intermediate crisis, or sudden or unpredictable crisis. Prognosis in HIV. The risk of HIV is AIDS, death, or both is predicted by the CD4 count in the short term and plasma HIV-RN level in the long term. HIV-associated mortality and morbidity varies by CD4 count, with the most deaths from HIV-related causes counting to about 50%. However, for a person whose initial response to treatment was not quite good, life expectancy was a little shorter. Results were broadly similar in each of the following scenarios: a CD4 count between 200 and 300 at the detectable viral load, and a CD4 count above 350 and a detectable viral load. A person who is 35 years could live to around 70 years with effective treatment. With no proper cure for HIV, a lifelong drug treatment is considered necessary. A person living with HIV infection should be advised to take their antiretroviral drug continuously. There is also a risk of opportunistic infections or death from any cause. Most deaths occur from premature coronary arterial diseases, cerebrovascular events, or livers and kidney disorders.